This is such a detail-oriented piece of the aesthetics licensure course at Southeastern Aesthetics Institute. It's something that I love including at Southeastern, and it's just a great thing. So one of those things that I love to mention is that, you know, eyelash extensions are not usually included in aesthetics programs. We want to make that happen. So of course, with everything going on, if y'all feel like y'all need more training from me, just come back. I've got tons of alumni that come back a year later, 2 years later, 5 years later, and they want a refresher on something. That's what is so cool about you guys, is that y'all get that from us. Of course, y'all don't have to pay for one daggum thing unless you're coming to a CEU course and getting your CEU credits. But if you are coming back just to refresh your education, that is for you. Additionally, as alumni, we of course give you guys perks in terms of services and the spa and that sort of thing. So we want to give y'all things for a lifetime because y'all are part of our family. So that's a great piece of the puzzle. Great perks for you as a member and a family member at Southeastern Aesthetics. Okay, so we're going to go through my slideshow first. This is one that I teach for eyelash extension certification, CEU courses. We have that approved in South Carolina as the only eyelash extension CEU class approved for CEU credit in the state. So that's cool. So we're going to go through this really quickly, and then I'm going to get into the Borboleta branded presentation for you too. So we're going to go through two things. So join me here. So if you were part of my certification class, I would start you by asking you a couple things here. The question is, what is your favorite thing to perform in the industry? What do you feel you excel at the most? Many people for eyelash extensions love eyelash extensions only, right? So they want to perform it day in and day out. They love it. It's a great source of income. So that could be your favorite thing. Or if you've never done it before and you're a big waxer, if you love detail-oriented pieces of makeup artistry, you know, lash extensions could be a great thing to add on. But understanding what you excel at definitely helps me teach you the hands-on part of this. If you've already done a lot of detail-oriented work in aesthetics, it is relatively easy for me to teach you eyelash extensions. Or if you have not, and if you've not done one little thing, I know to spend a little bit more hands-on one-on-one time with you, making sure you excel in this craft, right? And the next question is, what are your top 3 goals you want to proclaim and accomplish in the next year and in the next 5 years? I think right now with everything going on, this is such a perfect time to really sit here and figure out, what do I really want to spend my time doing that makes me happy, that brings joy to the world, that makes a difference for my clients? And it's just a great question. And then of course, the bigger question, the broader question is, where do I see myself in 5 years? So it could be more or less just kind of perfecting your craft, getting the education in now, so that in 5 years, you can own your own studio, own your own full spa, own a salon, definitely take over the world, whatever it is you want to do. So these are great questions to ask yourself right now, okay? I love to start lectures like that sometimes because you guys really need to look at the end game to really focus in on the detailed pieces of the education you're learning now. The end game is really the best question. So ask yourself that today. Write your answers down for me. Even email them to me. I would love to know what your goals are and how you're going to achieve those goals. So the next and last question on this one is, what are 3 specific action steps you can take to achieve these goals? So right here, right now, here's one of them. You're spending this time when you could just be watching the news, which is the worst right now, right? Stop. Literally, we turn it on for about 5 or 10 minutes in the morning, and that's as much as I can take because negativity is what breeds fear. And it's good to be in the know, but let me tell you guys something. The more positive and optimistic you are and focusing in on what is actually going to bring joy to the world, joy to your life, joy to your family, make a difference, those are the things that are going to mean the most. At the end of the day, it's really all about your mental mindset and your energy being a good positive one at all times. So what action steps are you taking to achieve these goals, but to really keep your peace and your happiness at the forefront of every day, right? What are you doing to achieve that? Okay, so really quick, this is a good review because when I do a certification class, it is all about sanitation first. So we're going to go through this relatively quickly. So important terminology, guys, make sure you know this. And when you're back on site with me, we're going to do our little quizzes on this. Y'all remember these. So this is a great review. All of you and most of you have not taken state boards. Okay, so even if you think you know this stuff, I promise you, you don't. Until you're licensed, you're not an expert yet, right? So let's go through this. OSHA stands for what? It stands for Occupational Safety and Health Administration. OSHA regulates health and safety in the workplace, primarily for your safety. But I will tell you what I love about just everything going on right now is how great we have always been at Southeastern regarding sanitation and making sure we go above and beyond. So wearing gloves, making sure we hand sanitize constantly, making sure we always change out our linens or our disposable sheets, you know, things like that. We are so good at that. And that's what I love about you guys is that y'all practice this all the time. So it's not a big deal. And then EPA, what does EPA stand for? When we talk about EPA registered hospital grade disinfectants, EPA stands for Environmental Protection Agency, okay? And EPA registers many different types of disinfectants. On the next slide, we're going to talk about types of disinfectants, and that is very important to your education. It is very important to know that barbicide is not the only disinfectant, guys, not the only one. That's a brand, and that's wonderful. And yes, barbicide has its own online certification for free, so y'all should take it. But listen, that is not the only one. So make sure you know the different ones and you will be a very well-rounded licensed provider. Okay, then gloves. My question for you is, what types of gloves do you normally wear? And you're going to see me wear it when I do my classic lash video that I'll post later this week. Okay, nitrile gloves, N-I-T-R-I-L-E. They are latex-like yet latex-free, right? Nitrile gloves. We don't want to wear vinyl gloves because they're very loose, kind of lunch lady style, very not form-fitting to your hand, but you have to have very tight gloves so you can work with details and small little lashes, right? So keep that in mind. And then if you see the pictures here on this slide, we have our barbicide jar, but what is that really called? That is called a wet sanitizer, guys, okay? A wet sanitizer. What we do with wet sanitizers is we follow the protocol by taking, let's just pretend, I wish I had a pen or something, but if I had an implement like an eyelash extension tweezer, I would take it over to the sink, wash with antibacterial soap and water, and then place it inside our wet sanitizer for 10, 15, 20 minutes, whatever the manufacturer's directions say to do. Then you take it out, dry it off, put it in a dry storage labeled container. It is not meant to be a storage unit, okay? If you've ever been to the salon and you see hair cutting shears, combs, implements, whatever, just sitting in the wet sanitizer for just hours on end, that is not what it's meant to do. And if you see things floating around in there, that's also not what it's meant to do, right? We want to clean these out every single day, turn it over to air dry, and you're good. And then if you're looking at that picture over to the right, that is what is known as an autoclave, okay? Autoclaves, you don't have to have them in South Carolina, but if you do, they have to be spore tested every 30 days by an outside entity. So it looks like a little mini convection oven or something, right? You're gonna take your metal implements only because anything else would melt, okay? You're gonna go in there and they're gonna bake forever, how long? Until you need to remove it. Of course, make sure that the heat is completely gone. Make sure you pull it out. Sometimes wear gloves to pull it out. It could be still hot. You're going to put these in individually packaged bags if need be, or in a dry storage container that is labeled. And autoclaves do what? They do the step called sterilization, which removes all microbial life inclusive of spores. So we have another slide coming up that discusses this. So just make sure you fully understand what sanitizer goes with disinfection. Autoclave goes with the term sterilization, okay? You don't have to have an autoclave, but it looks really neat. You should totally add it as a part of your dispensary. Then this next one is 3 steps of cleaning, decontamination, disinfection, sterilization. So sometimes I've done this slideshow and I've not put the definition. So if you want a copy of this slideshow, please shoot me an email now and I can send it to you. I'll probably also put it in our Edmodo chat for all of our active students. So just make sure if you are an alumni of mine, shoot me an email and I will post this there for you. But decontamination, disinfection, sterilization, you need to run through all 3 steps in order to truly clean an item. So again, since we're talking about eyelash extensions, if you have a pair of metal eyelash extension implements, what are we going to do? We're going to take it over with gloved hands to the sink. We're going to decontaminate it by washing with antibacterial soap and water to remove bioburden. You see on the slide there, I put bioburden in all caps. Bioburden is a term you'll probably have on your state board theory exam. And what it means is dirt, debris, dead skin, you name it, anything that's on it. So you can't just simply take your eyelash tweezer and place it in the wet sanitizer. That would be out of compliance. You need to take it to the sink first, wash off all the dirt and debris, right? Before it goes in the disinfectant solution. Otherwise, it's considered to be contaminated. So make sure you don't forget decontamination. I always say that's probably the easiest one to forget when we are busy and working in the salon, but make sure you put a star by that, write that one down. And when you're going and actually going out on job interviews, once all this is over, I cannot wait to help you guys with that. You need to showcase to them that you understand sanitation beyond measure. This is such an employable topic right now that you guys really will get those jobs and go above and beyond to make sure your employers know that this is number one. We teach this and drill it into you. So it's second nature. We are going to decontaminate first. Okay. Don't forget that. And then disinfection is the removal of most, but not all, microbial life. In the example, I like to kind of connect knowledge here. So we're going to place implements in the wet sanitizer for 10 to 20 minutes. So remember, in that slide prior to, we talked about the wet sanitizer, the tall barbicide jar. That is what you place your implements into for the step of disinfection. Okay, so connect the piece of equipment with the term. Then sterilization is the removal of all microbial life, inclusive of spores. And what this looks like in the example is placing metal implements only in that autoclave for however long it needs to stay on, but it bakes away additional microbes. And that is such a neat thing. So again, take the term sterilization, connect it with a piece of equipment, autoclave, and you will not forget those. So again, 3 steps of cleaning, decontamination, disinfection, and sterilization. All right. Now, you'll like all these colors, huh? It gets you excited about disinfection, I would say. Types of disinfectants. Everybody say quaternary ammonium compounds, right? When I have people say this in class, they're like, huh, how do I say that? But you can also call it quats for short. So quaternary ammonium compounds, guys, that is what is going to be what you use a lot. So specific examples by brand of a quat solution would be your barbicide, cavicide, leucocide, citrus 2, whatever else is out there. So quaternary ammonium compounds. If you actually look at barbicide and look at the ingredient label, it will have 4 different types of ammonium compounds in there, hence the name, right? So just keep in mind that it's stated as such for a reason. Definitely start reading ingredient labels. You'll do this a lot as an esthetician. That's what we do best, and you'll be all set. Then I always say if you smell bleach water over at daycare centers, you know that that is totally fine because it's a type of disinfectant. You can take bleach and dilute it to a point, right? You can put it in a spray bottle, you can use it to wipe down your surfaces, and that's totally fine. It is a type of disinfectant, but it can bleach your clothing. So I always say when I'm wearing my black pants or scrubs or whatever, you want to steer clear of your bleach solutions, but they are registered disinfectants. So for those of you at home cleaning your homes, wiping down surfaces, you can totally use bleach solutions, but typically they need to be diluted a little bit. Look in your books, in the foundations book, in the disinfection sanitation chapter. It talks about dilution and what to do specifically. And I think there's some neat charts in there for you guys regarding that. And then phenolics with a pH is the third one. Phenolic solutions, they always say, are harmful to hair, skin, and eyes. So keep that in mind. Phenolic solutions are utilized in industrial cleaning only, or places where people would be wearing gloves, face masks, that sort of thing. So we don't use that in the salon environment one little bit, but it's worth knowing. And what you don't see there, keep in mind, is alcohol, right? We always have been telling you that alcohol is not a registered disinfectant. It states that in your textbooks. And I will tell you, for those of you that have noticed that they've talked about hand sanitizer on the news lately, and that's fine, it does help, right? But because alcohol is what hand sanitizer is made up of mostly, it is not necessarily a disinfectant. And so for those of you that think you need just bottles and bottles of hand sanitizer right now during this quarantine, it's not the end of the world if you don't have it, because frankly, it's not a disinfectant. It does help. It's meant to be more of a stripping agent, so it can assist, but it's not going to be a disinfectant to surfaces like these other three, okay? So keep that in mind. You can actually probably do a lot of reading on that subject. How effective are hand sanitizers right now? Look that up. I'm sure there's tons of good articles on that one, and that should help bring this true to you when you have that on your state board test, okay? All right. The last sanitation one, before we get into eyelash extensions, that's the best part, right? What is the difference between bacteria and a virus? So bacteria are one-celled microorganisms, also known as germs. So examples that you need to know for state board are cocci or cocci, bacilli, spirilla. So remember, MRSA is methicillin-resistant Staphylococcus aureus. Can you say that one 10 times fast? I don't know. So keep that in mind. That is one that's very spreadable in the salon environment. We want to prevent against that, which is why I suggest you wear gloves for everything. The Board of Cosmetology does not require you to, but it is a great idea and something we have always done at Southeastern. We always keep gloves in stock. It is a wonderful thing. So wear those gloves, guys. Make sure you change out your gloves every so often, especially if you touch your hair, if you touch a surface, if you pick up something off the floor, it's time to re-glove, okay? Then, viruses are smaller than bacteria and exist by taking over the host cell's reproductive function, the host being you. So they take over your cells, and viruses, of course, we know all about viruses right this minute, but the flu, HIV, the common cold, all of those are examples of viruses, okay? So you do want to know the difference between, you'll have this on your state board test, absolutely, so just make sure that you know that one. Okay, so we've got about 10 minutes left of just discussing my slideshow. Then we're going to scoot over to Borbulette, and they've got some neat little video clips in there. So I'm going to totally send y'all this recording today because it'll be a great start for those of you that want to just get into the training at home, right? Until we get back in the class. So eyelash extension consent form, listen up. Clients must have hair to attach extensions to. This is so true and so real because worst case scenario, somebody is an oncology patient. You know, many times people think, well, if I do eyelash extensions, I can really help these people that are undergoing chemotherapy. But I will tell you, you need to technically wait until a year out from chemo treatments because chemotherapy, it creates hair loss, as you know. So you have to have a hair to attach any extensions to. So therefore, doing eyelash extensions on someone without hair is not going to be a possible thing, okay? Now, I have taught you guys something called stacking, and I have done it on oncology patients that do have some hair there. I'll show you some interesting ways to create volume fans and create kind of a springboard to attach other hairs to. So there is a possibility, but you can't just have nothing. Otherwise, you can't create the springboard to begin with. So there's some, you know, ways you can, and there's definitely ways you can't, but just keep that in mind for general questions. Additionally, people with alopecia that have lost hair. I remember when a client came in to see me for this, and I ended up having to assist her as she was crying, and I, you know, sat there and did her makeup, and I said, look, you know, you definitely have alopecia. You have a hole eye with no hair, which is fine. We will get you to a place where you are happy with the way you look and you're going to be so thrilled. Don't you worry about that. You're gorgeous inside and out. It's not a big deal. And she had some hair over here, but it wouldn't have made much sense to do some extensions over here and none over here. It wouldn't be uniform or even, and it would just make it look worse probably. So we made her happy. I promise you that. She was good to go. We did some other services for her, but keep in mind that clients must have hair to attach extensions to, okay? The next one says they must not rub, pull, or pigment lash extensions for sure. If you're someone, or if you have a client that rubs at their eyes constantly because you have allergies, or pulls out their eyelashes and eyebrows, that is an anxiety disorder that people do have, they don't need to get this done. It's just going to make it much worse when you attach something a little bit heavier to their eyes and then just start pulling it right out. Number one, they're spending money with you for no reason at all because they're going to pull out the lash extensions, but it just causes harm, and we don't want to cause harm. So consultation is so key, and that is just the basis of everything with aesthetics. The next one says they must understand the natural hair growth cycle of 3 to 4 weeks. This is so key. Now, if y'all know me, you know that let me resituate my chair here. You know that I don't do fills. I don't do fills, and I think this is a great moment in time to really rethink that for most everybody, because you can't see microbial life with the naked eye, guys. You just can't. So even if you think you're cleaning really well in between fill appointments, you probably aren't, even though it looks good, you're ready to go, whatever. So rethink that. If you do offer fill appointments, definitely consider only doing it once or twice at most. Then have the client remove all their lashes, soak them out, and then do a full set each, every other time. So keep that in mind. So if you're doing fills, this is when you would do it every 3 to 4 weeks, some as often as 2 weeks. Okay. So if you're like me and you see some people that are news anchors and people in the, in the public eye, they want their fills done every 2 weeks or new sets done every 2 weeks. So I typically set up my clients to know how to remove them at home. And here's how you do it. You can't just start pulling them off, and soaking them for 5 minutes isn't going to do it. So I always say you can even retail people the remover solution at home, but that's very chemical based, and I'm not a huge fan of that. So I'd rather people use coconut oil, baby oil, something like that. Even olive oil is a great natural substitute. Anything oil-based degrades the glue. So you're going to take some cotton rounds, kind of douse them in whatever oil solution, let them soak on the eyes for 30 entire minutes. Have your client set a timer on their phone, take a little nap, meditate, whatever, and then they're good. They can then take that off after 30 minutes, and they should be able to shimmy off the extensions with their fingers. You'll see how I'm doing that. Shimmy, not pull. We're going to shimmy them off, and then you're good to go. So keep that in mind. Education is so key. And if you don't have that, you're going to have people come in with all sorts of odd requests. I had to train this one client. She was a CEO at a big museum here in Columbia. Love her so much. However, she would come in, and this was when I was still doing fills, and I kind of told her, I said, well, you're not going to be one of those people that I could do fills on anymore, because you're coming in on your lunch break. You expect me to do a very quick fill, and you have eyeshadow all in and around the eyelash extensions. So you're not cleaning them properly at home. So let's regroup here. No big deal, but I'm going to need you to soak your lash extensions off the night before you come in for your appointment, and it will be faster, cleaner, more sanitary. You'll be happy. Won't feel as heavy, right? Because we're not doing just fills on top of fills, and then all is good. So training your clients is such a big piece. But then the last thing here is such a short sentence for a very big issue, because this could really discuss a lot of different issues that clients would have, but they must understand the immune system health issues and medications can directly affect lashes. That's so important. So what immune systems am I referring to? Remember in the hormones lesson last week, we talked about Addison's disease, thyroid issues, PCOS. We talked about other hormone disorders, but what about diabetes? What about lupus? What about other things that people just have that are, pretty common? Immune system disorders. Or what if they're just sick that season? They've just gotten over the flu. A lot of people have suppressed immune systems in today's world. So you need to make sure clients understand that it's not necessarily your fault that lash extensions aren't having a good retention rate for that client. Could be their underlying health issues, and that is okay. But as long as it's discussed, you might need to have them come every 2 weeks, right? Or they might have someone with seriously amazing lashes, which is most young people these days, or my son, right? Men always have the best lashes. People that have great lashes, they can truly come back once a month, once every 4 weeks, and they're good to go. And then, of course, medication specifically, that can be a number of things, but medications in general can cause hair loss. It can cause hair growth. I mean, it just depends on what they're taking, and it's just a good idea to say it out of your mouth, have them sign that they understand, and then you can move on and have a wonderful relationship with this client. But consultation is so key. All right, this is why I put together this slideshow for you guys outside of the Borboleta slideshow. This is my specific suggestions for your treatment room setup. So many of you are setting up little spaces in your homes. In the student alumni group, I just showed y'all mine, and I've had this office set up like this for a while. I haven't really used it, but we're going to be using it a lot this week for hands-on filming. So that's great. But when you're setting up to practice at home, you'll want to make sure you have the right items. Of course, Amazon has a lot of free shipping options. Prime is great. Get yourself a flat treatment table, or a table that can lay flat. You cannot have people on an incline, really. And I will tell you, if you look at that picture I just posted in the student alumni group, and I will probably see if I can post a picture of this later, but my pillow, let me see if I can turn this around so you guys can see. Can y'all see my pillow on my treatment table right there for clients? It's got like a little nice neck cradle there. That's the kind of stuff we don't have at school, but y'all should totally get for practicing. And I did order that. I'll just send you the link on that. I do love my ring light. And of course it says here magnifying light. Lash trays, I do teach y'all classic lash sets at Southeastern Aesthetics Institute. I can totally teach y'all volume. So this would change for volume sets, but I need y'all to feel really good about classic before y'all get really into the volume sets, okay? So lash trays, in your student kit, y'all have 0.15 millimeter, which is fine. Y'all do know me enough to know that I like my thicker lashes a little bit. If you're going to make pre-made volume fans, then wonderful. Those are inherently thin. They're actually 0.07 millimeter trays, which are super thin, which makes it easier for you to take your volume tweezer, pick them up, and kind of create that little 3 or 4 prong fan. They do have up to 0.25 millimeter lash trays for thicknesses, okay? But I usually will take that, and I'll walk you through this on my hands-on piece later this week. Where I take the 0.25s and I do almost just kind of a sporadic fill towards the 3rd round. And y'all know I like rounds. I'll teach y'all that as well. So rounds are a big deal. I teach you that when I do the hands-on thing. Normally I have a board where I show you rounds, but the way Borboleta does everything is through mapping, which is totally fine. So there's so many different ways to do eyelash extensions. Definitely learn from a lot of different brands. I first learned from Extreme Lashes back in 2005. I went to Atlanta right after I went to a MAC makeup school in Richmond, Virginia, drove right down to Atlanta, then went to esthetician school. So many of you that have done your certification classes first, I totally understand because I did it too, so then I did Bella Lash Extensions training, and of course I've done Borboleta Lash Extensions training. They came out to the school, trained me on their brand, and I will show you some of the things I've taken from all brands when we get to the Borboleta slideshow in a moment, because there's things that have changed over time, which it's so great for you guys to learn it in these neat ways, and things that I thought were just so crazy ridiculous a long time ago that now have evolved, which is a good thing for you. If you see there, you want to make sure your lash tweezers are sharp, okay? My tweezer sharpener, I'll have to pull this up for you. Let me pull it up now since y'all are actually watching my screen. If you guys can go to Texas Electrolysis Supply, this is such an old school website, let me tell you. You're going to click here to go to main website, okay? And if y'all know me, y'all know these are my, like, just my love, or my tweezer sharpeners. The only reason I know about electrolysis is because my mother did electrolysis in the 90s. That's how I got into this industry. So, such a random website, right? But I'm telling you, nobody carries these. Go to tweezers and accessories. Go to specialty tweezers, and then the Dumont tweezer straightener for 35 bucks. Y'all cannot find these on Amazon. It's the craziest thing. But these are the tweezer sharpeners. Do y'all see how thick and heavy that looks? And how if you took a very sharp pointed tweezer and you kind of took these Dumont tweezer sharpeners, kind of pulled straight, it pulls the adhesive off of your tweezers, which is a wonderful thing. As y'all start practicing, you'll see what I mean. And then also sharpens your points. There's no other tweezer sharpener better than the Dumont tweezer straightener. So email me if y'all want me to send y'all the link on this, because it's just such a big thing. But it's TexasElectrolysisSupply.com. How about that? Okay. So wrapping this slideshow up, these are just things I want y'all to have. Of course, surgical tape, you'll see me using that when I do my hands-on video for y'all this week. I love a good surgical tape. That's something that I recommend that people don't recommend, or don't necessarily recommend, but they probably use it. A lot of your very professional eyelash extensions artists do use surgical tape. It is a little bit more firm on the skin. So people that have higher cheekbones, inherently, a lot of the collagen pads will push up into their eye, and you need something that just kind of adheres to the skin a little bit more, and that's what surgical tape is all about. Now, I'm going to briefly say this, and for those of y'all that have already been taught by me, you can hear me having said this to you, I'm sure, as we're doing our hands-on stuff for Eyelash 2 training, right? So this will make more sense when I actually do it, but I'm just going to say it really quick. So we're going to put 2 pieces of surgical tape on the bottom lashes and or collagen pads, whatever you guys decide. Then we're going to take our pointed tweezers. I'll show you which ones in the hands-on video. Dip the lash in adhesive. Isolate with your less dominant hand. We'll talk about that when I'm doing the hands-on part. Apply the extension on the full length of the lash. That's a little typo, but the full length of the lash. So from the bottom to the tip. That way you take the adhesive, y'all, and you're not just putting it on one part of the natural lash, you're putting it on the whole length of the lash, then setting it on at the base or from up underneath or on the side. We'll talk about that with the Borboleta slideshow, so remember that. Turn the lashes facing towards the outer corner. So remember, lash extensions should go out towards the temples, okay? They shouldn't go in towards the nose or be crisscrossed or crazy looking. See where it says lashes should fan out and not stick to other lashes. So I'll show y'all, of course, how to do this very well. Lashes may be stacked or fanned, whatever you want to call it, once full set is applied by using 2 lashes as a support beam for a lash to be applied at the base between them. So when I'm teaching classic lashes, I kind of teach y'all how to do a specific fanning technique that I call stacking. So let's say that these 2 fingers or lash extensions you have applied. We can then take another extension and place in between here and create a 3-prong fan. So I'll show you how to do that on the client, but you can also make pre-made fans. There's so many different ways to do lash extensions, but you need to learn the classic first, okay? Then eyelash extension aftercare for the next 24 hours. This is important. I always say, get on Canva, create yourself a little infographic, and then send this to your clients, okay? Because they need to know. Don't print it out. Email it to them, text it to them, because people like to use their phones all the time. So make sure they have this stuff digitally. So for the next 24 hours, do not expose extensions to water, rub, tug, or play with extensions, or apply cosmetics, especially oil-based, to the lash line. So those are big no-nos, okay? Don't expose it to water for the first 24 hours. Listen, I've had extensions in. I've totally exposed them to water. It wasn't the end of the world, but this is a very generic thing that they have always said, so just don't do it. It helps allow the adhesive to cure correctly, right? Don't rub, tug, or play with the extensions. Make sure that you understand that mascara is oil-based. Did you know that? So applying mascara to eyelash extensions is kind of a big no-no because it could cause the lashes to fall out prematurely. That's something to think about. Anything oil-based is going to remove the adhesive. So look at the next point. It says, use baby wipes or oil-free makeup remover wipes to wipe above and below lashes daily. These are my suggestions for you. Having done this since 2005, okay, I've done eyelash extensions for a long time, and I can do a full set in about 35 to 40 minutes. True, yes. And this is my suggestion. So why do I say that? Makeup remover wipes are usually oil-based, and y'all know I'm not a wipe fan anyway, right? But if you want to use some baby wipes, that does help when you're trying to keep retention a thing with eyelash extensions. So baby wipes are not oil-based, but you can wipe above and below and get all your makeup off around that, and then you're good to go. Wash around lashes gently when washing the face. Lashes may become wet, but it's encouraged not to constantly immerse it in water, guys, as it's tempting to rub the eyes, right? When you get in the shower, what do? You wet your face and then you rub your eyes. I don't know if y'all realize that, but think about that next time you hop in the shower, because you totally do. So what are we going to do? We're going to change up our routine. Stand in front of the sink first. We're going to wash off everything around our lashes, do our little facial scrub, do our, whatever, and then hop in the shower. Try to keep your face away from your lash extensions, and then you're good to go. So it's just a little bit of a routine change and you're golden, okay? Use a mascara spoodle brush to gently separate lashes daily, okay? So you're going to give that to the client, because when they start growing out, they start to turn a little bit, and that's when clients are like, oh, well, it's time for a fill, it's time for a new set, whatever the case may be. And then, of course, the one right before that, it says nothing oil-based on the eyes. We said that already, including mascara, oil-based cleansers, or makeup removers. That's why I love my molecular water, because it's oil-free, whereas a lot of makeup removers tend to be oil-based, right? The last point is so important for clients to know. Do not worry if 1 to 2 lashes have fallen out, as we normally lose 1 to 5 natural lashes every day without noticing. Did you know that? A lot of clients don't know that. So when they see an extension possibly fall out a day or two after application, that is a natural thing, but typically they may not see that because you've done so many that it's really hard to notice when lashes do fall out. But some people do pay attention to this kind of stuff, or see it, or it might kind of fall out on their pillow. So of course they can't lay straight down on their pillow. They gotta have to tuck your pillow up underneath their lashes and let their lashes fall out, or kind of lay out on the edge of the pillow, right? But just make sure you make that point to them. Do not worry if 1 to 2 lashes have fallen out, as we normally lose 1 to 5 natural lashes every day without noticing. Good points, right? This is the last 2 things, and then we're moving over to the Borboleta slideshow, which I know y'all are excited about. And for those students that are my new babies and y'all have not gotten your kit yet, I'm going to check in with Erin and make sure those get to you ASAP with your manuals, because the Borboleta slideshow pairs well with the manual. So you'll love that. Okay, and then you can start practicing on your mannequin heads, which is so fun. All right, avoid extreme heat. Do not pull on lashes. Do not sleep on lash extensions. So important, okay? Fill-in appointments. We said this a minute ago, as often as 2 weeks, but at least every 3 to 4 weeks. Make sure lashes are free of mascara and makeup during fill appointments. So key. So if somebody is just a serial makeup, person, and they come in with mascara and eyeshadow just all in and around the lash extensions. Number one, you don't have time for that. Your time is valuable. You don't want to spend most of the time block that you have for this client removing all their bacteria, dirt, debris, whatever it is on their eyes. You want to get right into it. Okay, so oftentimes if I have that client, I'm just going to send them straight to the bathroom with some cleanser. Go ahead and let them wash out as much as they possibly can, and then I'll get going from there. Okay, so it just depends on what time you want to, commit to this and what you're willing to do, how much time you have. But it's a goal of yours, I always say, to book your clients every hour on the hour. If it's a new client, maybe every 90 minutes. But if it takes you 2 hours to do eyelash extensions, then you're doing something wrong. You're doing a disservice to yourself. You're not going to make as much money. Your clients are not going to be as happy. They'll go to someone who's faster, quicker, and can get them in and out. Okay, so think about timing being key. When you're first learning this, there's no way you can focus on time yet, but it's something to pay attention to. All right, y'all ready? Let's get into the Borboleta slideshow here. If you have your books, please pull them out. If not, no big deal. I will record this, send y'all the recording, and y'all can look back through with your books another time. But your training kit, I always say, is so cool. You actually get 3 lash trays, a C, 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 and D curl. We'll talk about those differences there. You get 3 sets of tweezers. Of course, I have my 2 favorite, the curved ones. The straight ones we kind of just have off to the side as extra. Your pre-treatment is fine, but listen, I've learned things old school before any of that existed. So if you want to use it, by all means, it does help the lashes adhere a little bit longer. However, you know, your retention is still going to be 3 to 4 weeks every time, just genetically. So pre-treatment, you want to use it. Just keep in mind that timing is key. If the lashes get wet, then you need to let them dry before you get going. You're going to use those microfiber brushes to the right to apply pre-treatment with, okay? Then, of course, you've got your adhesive. Your adhesive needs to be shaken up for 30 seconds prior to dispensing. We'll talk about that. There's some good videos coming up for you. You've got your collagen pads by this company. This company has even better collagen pads than what's in the training kit, guys. So look on BorbolettaBeauty.com. and you can check out some of their really neat products, some of their new launches, really cool stuff. They do give you some mascara spoodle brushes to give to your client. I would totally order these in bulk from another website. You have your paper tape, which is totally fine. This will show you in this slideshow how to use your collagen pads and paper tape. When I do my video for you, I'll show you how to use the surgical tape. So different ways of doing it. Then you're either going to have your jade stone or your crystal stone on your palette. Okay, some of you don't even have the jade stone, you have the crystal stone, which is fine. What that point is to keep your adhesive cool when you dispense it on there, in order to ultimately make sure that it lasts as long as it can. So you'll see how we actually dispense it on the jade stone. We're going to put a piece of paper tape horizontally over the jade stone, shake your adhesive up for 30 seconds, and do a little bubble of adhesive. Let's not get adhesive all over the place, right? We don't want it to look messy. We want to keep things clean and neat at all times. Okay. So eye anatomy is so important. Let's look at some of these things here. And of course, this is all in your books too. So peak of the brow is very important unless you want to go beyond 15 millimeter. Now, Borboleta only has lashes up to 15 millimeter, which I find to be very long. But for some eye shapes, 15s can just be an average length. So there are companies out there that go up to, 20 millimeters. I'm sure there's some even longer. So do your research, do your due diligence. There's so many brands out there, and you want to just kind of start collecting your supplies as you go along. Of course, keep everything nice and neat. Keep your little tray of everything handy. Kind of stack up your trays. You're good to go. You will have all sorts of options for you. The sclera is the white part of the eye. We always say we don't want to bruise the sclera. That's considered to be something we don't want to do. So when I actually showcase how this is done on a model this week, I will show you how to actually take the eye and lift it up on the client. Check right up under here. Make sure nothing is poking or sticking them in the water line, number 5, right? There is a water line right up under here you don't want to stick people in. And then, of course, the water line on the bottom, we don't want to allow tape or anything, for that matter, lashes included, adhesive, to get in, on, or under the water line. That's going to bruise the sclera, okay? The iris is the colored part of the eye. We know this. The tear duct is where tears pass through. I always have tissue handy. Give it to the client when their eyes are closed. So if there's any water pooling here, you are going to stop and you're going to kind of tap their little tears, I always say. And then the client can also tap their tears here, or here if something starts dripping to the side of their head, because the adhesive is very fumey. That's something that's never changed over years. Remember, I learned this in 2005, and I always thought, gee whiz, this adhesive is very, very fumey. We don't use the word burn, right? Fumey adhesive, so fumey. When you open the client's eyes, it takes a minute for them to kind of sit there and just kind of bat their eyes, and then they're okay. The fumes start to dissipate and go away. But y'all will notice in your kits that y'all have something that is a little piece of equipment called the nanomister. You can put distilled water in there, and the mist of it helps to cure the adhesive so it's less fumey during application. That is a nice new thing that did not exist when I first learned how to do this, so that's so cool that y'all have these options now. And then the orbicularis oculi is the big muscle around the eye. Remember, we need to remember that for state board, and it is for those of you doing anatomy chapters right now. Common eye infections, guys, blepharitis, that is where the eyelid skin becomes very puffy, and we don't want that. However, it can happen, and it's not the biggest deal in the world as long as you catch it from the start. So probably 1 out of 10 clients will get puffy eyelids the first time they get eyelash extensions. It's very common, and it's unfortunately so because eyelid skin is very thin and sensitive. So you want to say, client, you know, I know I've never seen you before, but if you'll do me a big favor today, since this is our first session together, and go home and take a Benadryl, that'll cut down the histamine response that would then induce blepharitis or puffy eyelids. So that's something to keep in mind. You always want to get on the front of things before it even happens. And it might not even happen. But the fact that you made that suggestion, they're good to go, okay? Corneal abrasions, that's the same thing as bruising the sclera a lot of times. If you take adhesive that's dried up, and golly, you're not going to apply adhesive incorrectly either. If you apply adhesive to a lash and it's very clumpy, then it's going to become dislodged and get up underneath the eyelid and sometimes cause a corneal abrasion. And that is something they would go to the emergency room for, guys. We don't want to cause that. So when you're doing your one-on-one time with me, because I love doing that with you guys, we're going to make sure that we don't cause corneal abrasions. And that's not going to happen because you're going to apply the right amount of glue and you're going to clean up any mess before you move on to the next lash. We're not going to allow tons of glue to get in and around the eye. No big deal. We don't want to have bruised sclera for sure. That's called scleritis. Demodex mite. Ooh, let's look up something else, y'all. Lash mites. I love showing this to my class. I mean, not really because it's kind of gross, but look at that. What we don't want to cause is lash mites. Isn't that gross? So this can happen to people that wear a ton of strip lashes all the time, okay? So if you're one of those that wears strip lashes all the time, sleeps in them, doesn't really wash their eyes properly, I promise you, you're gonna have little microbial life, such as the Demodex mite growing at your lash line. And that happens when oxygen flow is cut off from the hair and bacteria sets in, and you just kind of have created this breeding ground for nasty little mites growing up underneath your eyes. So not fun, right? So the Demodex mite, want to prevent against that. Eyelash extensions, that can happen for eyelash extensions if you do fills over and over and over again. So we don't want to be that lash artist that does that. Sanitation is key, right? We don't want to cause dry eye, but I promise you, people that have dry eye most likely won't come to get lash extensions done. They know there are limits on that. Styes, glaucoma, conjunctivitis, you don't want to treat people with any of these issues. Of course, if somebody has conjunctivitis, which is pink eye, that is very contagious, and you do not want to treat someone like that. You would have to replace all your supplies. Nothing good about conjunctivitis. No. Okay. Then they show you how to do some really neat cleaning though. So you're going to have some cool stuff in your kit. The lash bath is one of them. And let's watch this little video here. Of course, let's just assume she's got a nice clean hand. She's going to take her lash bath and place on the back of her hand that little makeup brush that's in there. You're going to see that come up. And that little dispense that you just saw with the distilled water, that's at the bottom of your Name and Mr. box, that black box in your kit. You're going to mix it together and then go through and clean. So this is something that they suggest you do either before applying or in the middle of seeing a client, like if you were doing a fill on someone. So this would help you, of course, clean off what you could, and then you're going to go in and do your fill. I do love that they clean the entire lid too, not just the lashes themselves with the lash bath. So I thought that was just really neat. And then, of course, I would say you would have to have the client on some sort of an incline to pour water in their eye that way, but that is an option. I'm just one of those people that really like for folks to go in the sink by themselves, wash their eyes really good, standing straight up, but this is an option for you too. So that is just food for thought there. Of course, you see them patting dry. And then you can go in and do what you got to do. The thing you're probably not seeing, which is so real with eyelash extension fills, is a bunch of ones that have grown out, okay, that you kind of have to remove a little bit with the remover solution and the microfiber brushes, because they kind of have created a root and they look like they could be banana peeled off. So that we'll show you some options. There's some videos coming up on that one as well. All right. So the growth cycle is the next thing you need to make sure you know. So for those of you that are watching my hair removal class later this week, we're going to talk about anagen, catagen, and telogen phase, ACT. Anagen stage is that first stage. Catagen is the transition stage. And telogen is the resting stage where it's fixing to fall out and then a new hair comes in behind it. When do we want to treat eyelashes for eyelash extensions? Ideally in the anagen stage, but is every hair in the anagen stage at all times? No, which is why you have people come in for fills or do full sets every couple weeks. Hair falls out and grows back. You know, it's just what happens, much like our skin naturally sheds every 28 days. So we want to make sure we understand this growth cycle and teach it to clients, because no, eyelash extensions are not a one and done. It's a, you know, very continuous treatment and service that you can do for people. So proper isolation. Remember these things, okay? You're going to hear me always say this. Isolation is not everything. If you remember one thing I ever have taught you with eyelash extensions, it is that isolation is not everything, okay? It is not. I also want you to remember that it's going to take you a whole 12 months to a year to get good at eyelash extensions or feel comfortable with it, okay? I also want you to know that you need to perform on 10 clients, 10 complete live clients, not your mannequin heads, folks. That's a good way to start, and that's how we do start all of our trainings. But I want you to remember that 10 full clients before you start charging for this. You need to see everybody's different curls and different things like that, and look at the slide. Do people have lashes that look like that are straight? No, they do not. And I'm going to show you in another training how that is so key. So wherever it is you need to apply the lash, you might need to put it on the side, on the bottom, or on the top, dependent upon how curly that hair is. If the hair is curling in here towards my nose, where do I need to put the extension? I need to put it right here on the side, fanning out, right? So my extension fans out towards my temple and we're good to go. So keep that in mind. So isolation is not everything, but here is how you do isolate it. Now they're going to do a two-handed isolation. Two-handed isolation is kind of what I call, you know, I mean, kind of babysitting yourself a little bit. The way I teach you is a one-handed isolation. If you do need to do it two-handed, that's fine. But you should be able to pick up the extension, dip it in adhesive, then isolate quickly with your less dominant hand, come over and apply. Okay, so you see how that goes? I'll play that one more time. So they're doing this two-handed, not a big deal, but the whole point is to not glue lashes together, right? So we want to move everything out the way, but do we need to do this all the time, everywhere? No. You'll see when I film my application step that we just kind of move things out the way very gently and then pop one in, move things out the way, pop it in. We don't have to completely separate it like we're parting the seas, right? That is not just required for everything. Probably more so in the middle of the eye, like she is doing there, because that's where you have most hair growth. But on the inner corner, on the outer corner, you don't really need to isolate. And I'll show you what I mean by that at a later time. All right. Then, of course, we already talked about workplace safety. We discussed all these points. We discussed what needs to be on an intake history form, but in your book and in this slideshow from Borboleta, this goes through a couple of other questions. You know, are you pregnant? That can be, you know, some hormone stuff going on where you could grow a lot of hair or not grow hair. Hair could fall out prematurely. Do you pick or pull at your lashes? Which position do you sleep on? You know, if you're a stomach sleeper, you can totally get lash extensions. Like I said, you just need to tuck that pillow up underneath, let the lashes hang off the edge. There's different ways you can do it. Then agreement and consent. Remember, we did talk about that. So important. Consultation is key. Now, the big thing you need to know about eyelash extension material is that we are working with faux mink hair, okay? Real mink hair, if you've ever played with real mink hair, which I have, and I bought real mink lashes several times, it is thin and it does not curl, okay? Real hair doesn't curl up like that. Do you see those different curls? You do want to use foam ink lashes with the different curls, and this is my favorite slide if you will look at this one here with me, okay? So the left column, we're talking about curls. The middle, when it says diameter, that's talking about the thickness of the hair. Most people like thickness rather than length, okay? And then length, you might have people that love their length, or you might have that little old lady that really just wants some volume. So we'll probably do more 0.20s, less on the length, probably 9s or 10s, right? Just depends on the client. So let's break this down a little further. If you look here, if you see my cursor, J curls, those have been discontinued by Borboleta since this slideshow has been made, and I couldn't agree more because these are very, very straight. I ordered a J curl pack not too long ago. I'm like, oh, let me see what this is. It reminded me of when I took my Extreme Lashes training a long time ago, and everything was just like stick straight hairs on a person. It was kind of ridiculous. So just keep in mind that straight is not really the look we're going for. B, it's all right. C curl is always a great go-to. Still pretty straight, I gotta tell you, now that I've used a bunch of D curl. CC curl is really awesome. It's in between a C and a D. D curl is my very best friend these days. I never used a D curl until I went with Borboleta, and I love me a D curl. I'm sure you do too. L curl, I've not used one of those, but it's a little bit more squared up on the tip, which is a look for sure. You know, when you're purchasing supplies, purchase what people are going to use the most. I would say probably CC and D's, you know, call it a day. All right, diameter. You're missing a couple of options here, I will tell you. So for volume lashes, you'll have something in between 0.05 and 0.10 called a 0.07. 0.07s are very popular for volume lashes. Again, you need to get good with classic first before you get into volume, so don't even think about volumes yet until you get down your classic sets. And you need to do 10 full sets of classic to feel really good about it. But like I said, doing this for about 12 months will give you that very good hands-on, you know, confidence that you need to then just master lash extensions to the fullest and move on to, you know, doing lots of volume. What y'all have in your kit are 0.15 millimeter thickness, which is important, okay? I love, and y'all know me, I love a 0.20. I really do. This is where my clients live. When I do my hands-on video this week, I'm probably gonna do a lot of 0.20s, so keep that in mind. And then 0.25, those are your thicker ones. You never want to do a full set of 0.25s ever because they're too thick, okay? They're usually too thick, but you can use a couple of them to really thicken up a set towards the end of the rounds. I usually do about 3 rounds. I'll show you in my video for you, and you will enjoy the way that looks. It helps you work faster and kind of more methodically in a pattern, okay? Lengths, your multi-length trays start at 8s and go up to 15s. I've never worked with 5, 6, and 7s, although they do apparently exist. I never really use 8s or 9s. They're too short. But if I've done a little old lady or something, of course the 9s usually are a great length for that person. But for most people, if you'll write down inner corners next to 10s, that is very, very common. Inner corners, you don't want to be long, so you're going to do your 10s. If you want to know what length is great for average sets, I would say 11s and 12s. If you don't know what to do, and it's little mama in the carpool line every day, and she doesn't want long, crazy lashes, she wants to look like she's got mascara on, we're going to go with 11s and 12s. And then if you'll put parentheses around 13s, 14s, and 15s, those are your longer ones. So most of our young little millennials or Gen Xers or whatever you want to call yourself, y'all got long natural lashes, so you definitely can do the 13s, 14s, and 15s and beyond, right? There's so many different ones. So this is a really great slide for just kind of looking at different curls, discussing with yourself diameters, deciding on what lengths. And of course, the more you have hands-on with this stuff, the more you'll be familiar with it. So they go into talking about what is an allergy versus what is an irritation. So symptoms of an allergy to the adhesive may include the following. You can read on that there, which is red puffy eyes, itchiness, swelling on both eyes, but that doesn't go away. I will tell you, don't worry about allergies as much as irritations, guys. Irritations can be some of those symptoms. They typically don't last more than 24 hours, okay? Look at what it says. Adhesive, tape, and gel pads can cause sensitivity. I always say, what do I say? Make sure you have that first client Every first-time client, take a Benadryl before they go to sleep that night. Make sure they do this because that's going to cut down on any irritations or puffiness, blepharitis that would happen to that client. Always get ahead of any issues that would happen. I always say too, make sure you follow these preventing irritation rules. Use your Nina Mister frequently to cure the adhesive. Use the proper amount of adhesive and not too much. Make sure you're in a well-ventilated room. You don't want to work in such a tiny room that it's going to cause the adhesive to give that person a sinus fit. I have had that before. I was at a spa local to Columbia and having one of my sweet alumni do lash extensions for me, and she had a diffuser going in the room with peppermint in it, which is ridiculous, and it made my sinuses go crazy along with the adhesive. So make sure you have nothing crazy going in the diffuser, right? But also make sure you're not in a teeny tiny little room. You're in a well-ventilated space with higher ceilings, enough filtration, whatever needs to happen, okay? Treating allergies, it says to wash eyes with sterile foam. We have that. Use sterile saline solution to rinse out any irritations. Use eye drops containing ketopen if you need to. Those are great things to have on site just in case that were to happen. Okay, everybody sitting at home and listening, everybody say cyanoacrylate. Okay, say polyalkymethacrylate. Those are some very long words, but these are some of the ingredients that are in this adhesive from Borboleta. A lot of adhesives are similar but different, so you might see some different ones out there that you like better, or you might like this one better. There's a lot of interesting things about adhesive, but like I said, you need to make sure you shake it up for 30 seconds prior to dispensing. Make sure you do not store your adhesives in your car, folks. I say this all the time, and especially students traveling in to downtown Columbia to come to school with us, or traveling to different salons. You might work at different salons, right, in different areas of town. And you don't want to keep your adhesives in the car. It can either get too hot or it can actually freeze over it if it's the winter time. I've seen that happen, and then you can't even dispense it at all. So make sure your temperature levels of 68 to 72 degrees Fahrenheit. Relative humidity levels should be around 40 to 60%. Avoid exposure to light, heat, and moisture. Store upright in a cool, dry place. I love my little mini fridges, and they actually showcase on Borboleta their Instagram page. I saw recently where they were storing some of their open adhesives in their mini fridges. So that's a great point. Of course, this is where it talks about not burping the bottle, which means do not kind of pull up a lot of oxygen flow by really pressing really hard down on the bottle when you're dispensing. You allow gravity to pull the adhesive out of the bottle. And of course, we said shake for 30 seconds prior to. They're going to show you a video now of how to do your Nano Mister. And y'all think that this looks like it's too far away from the lashes, but I promise you it's not, because here's why. If it's too close and the clients have been tearing up a little bit, it will cause their tears to turn this grayish white color. And then you come to me and say, Courtney, why in the world are their lashes gray or white? Is because you put the nano misting solution too close, and it's kind of combined with your tears to create this odd color on their lashes. So keep it very apart, okay? Taping is important. They're going to show you a cool video on taping here. They're going to have the client look up to the ceiling, pull down the bottom skin, and place the collagen pads on the tips of the bottom lashes, guys, not up in the waterline. That's so key. Then they're going to have the paper tape, and you're going to apply it from the outer corner up and kind of almost an X pattern, okay? Again, up to the waterline, but not in the waterline. So you see how this goes around the curve of the eye, and this is so important. So when y'all are practicing this without me, you have got to make sure you tape the lashes appropriately. If you do not, you will glue their eyes together. You see how they readjust on the outer corner there for comfort, and then it is all good. They put a little piece of tape on the lid, pull it back so it exposes the lash line. And of course, we'll do all this together, guys. We'll do all this together on site at the school, and you will be good to go. Okay, then This is another picture of taping. You'll see this in your Borboleta manuals. I do this a little differently with a surgical tape. I still do tape on the lids and pull back, but surgical tape always goes down here. Paper tape always up here. If you put surgical tape on top of eyebrows, it will pull eyebrow hairs out because it's so adhesive laden. You want to make sure that you understand that. Eye shapes are important, but not necessarily something I look at a lot, except for Asian set eyes. Asian set eyes are hooded, or any mature client that has hooded eyes. We don't want to do more cat eyes. That way it kind of elongates them too much. It makes them very squinty. Like you want to do more kind of longer in the middle for those hooded eyes, okay? And shorter on the outer corners. For closed set eyes, we could do more cat eye on the outer corner to create a longer, lengthier eye. Okay, for round prominent eyes, you could do, of course, longer in the middle, longer in the outer corner, no big deal. It says avoid D curls, which kind of makes them look way more wider up this way. Completely up to the client, honestly. I think lashes look good on anybody, no matter which way you do it, but those are some things to consider. You're going to see your mapping here. So when we start doing things with mannequin heads, you're going to place your collagen pads down with your paper tape. You'll see a little Sharpie marker in your kit. You're going to decide on what lengths and style you're going to do. So as you can see here, we had natural, dramatic. Here is cat eye. So you see there's different ways that you actually segment these out. You will draw lines on your own on the collagen pads and then decide on the length. Of course, you see the length only goes up to the 12s, which is fine for training, but I always say adjust this to 13s, 14s, and 15s, guys, when you're using the faux lashes on the mannequin head, which really quick, let me show you how to find that on Borboleta Beauty. Okay. When you go to this website, and hopefully it'll come up quickly for us so we can try to wrap up this training by 10:30. If you go to shop and you go to, let's say, all right, we don't want to do that right now. Let me look, accessories, that might be the way to go. Y'all already have mannequin heads. These, the practice lashes. The one thing y'all don't get in your kit are the practice lashes, but I highly recommend buying these. Look at how many sets that comes in here, guys. It's only $10. This is how you'll actually set up your mannequin head. And this is specifically done to where you don't have to put adhesive on the mannequin head. These bands that look really thick right there, that already has kind of a sticky, tacky substance on it, so you can just stick it right on the mannequin head. So I do suggest you purchasing the practice lashes for $10, folks. Very good idea. Okay. Then, of course, you have all these different ones. I'll show you how to do rounds too. All right. Then correct dipping. Correct dipping. Give me about 10 or 15 more minutes and we'll wrap this up. Correct dipping. Make sure you dip the lash when you're picking up the lash from the tray. I always say pick up the lash with the tweezer towards you. So from the tip towards yourself. So you've pulled it off. Then you're going to dip it in your adhesive from 2 to 4 millimeters, just right there at the base. Okay. This is the correct placement. Of course, they say to leave a little bit of space between the skin and the lash. I say don't do that. Okay, do not do that because you want to make sure that you back up the lash extension to the skin. That is so important. Okay, I'll show you what I mean by that, but a lot of trainings will have you leave this space, and what's going to happen is you're going to leave too much space and then the lash is going to turn. So I always say back it right up to the skin and you're good, just not on the skin, guys. They're going to show you here. You see how we've applied the tape horizontally on the jade stone or your crystal. And you're going to dip the adhesive or the lash into the adhesive. Now, I do this a little bit differently, and I'll show you why. That is fine, but I will show you the extreme lashes way where you kind of dip quickly and you hold the tweezers at the tip. You see how they were holding it in the middle? For beginners, you're going to end up getting adhesive all on your tweezers. So I suggest holding it more at the tip top of that lash and just kind of swooping it in and out super quick to get a bead of adhesive. Tap off the excess adhesive, then apply it to the lash. That is the right amount of glue, and I'll show y'all that later. And of course, my hands-on video for you. Okay. This is beyond my favorite slide because we're going to sing a little song. Remember my little song? We say, where do we put the lashes? On the top, on the bottom, on the side. Sing it with me. On the top, on the bottom, on the side. Okay? Such a good song, because here's why. Old school eyelash artists used to say you only could put the extension on the top of the NL, natural lashes you see there. Not so, folks. If the lash curls up, let's say this is a curled up lash, where would you need to put the extension? You can't lay it on the top, otherwise your extension is going to be like, bang, you know, going wherever that curl's going. You're going to have to slide that extension up underneath the curl so that yours goes where it needs to go, whether it's kind of fanning out more towards the temple there, or whatever the case may be, right? So up underneath or on the side for curlier lashes. Then we want to make sure we don't have it banana peeling up from the bottom like that. You see how incorrect bonding, when I come around and I look closely at your model, if you guys have this done incorrectly, it will start to peel up, and that's when they start turning too, and it's not going to look good. So make sure you bonded it before you move on to the next lash. Now they're going to show you the application. So look at how they're applying it on the side. They're applying it on the side. A little closer for you. And the point of the natural lash comes out to the side. No big deal. Apply your extension where it needs to go. That is so important. So I'll show that to you one more time. The extension is going on the side for this person's lash. They've isolated, they're applying it, and the tip is going where it's going to go. No big deal. We're going to make sure our extensions go where we need it to go, and that is the most important thing. Okay. Then moving on, exercise placement. Okay, so extension placement. We talked about placement. This is talking about removal. So banana peeling, breaking the bond, we're not going to do. And then gel remover, you could totally do, but I'll explain it a little further about how you can do it better than these videos. Banana peeling is easy. So you're going to take two lashes with your two tweezers there, and you're just going to simply pull them apart. Easy enough, right? Look at it a little bit closer. You're going to pull the tips apart from one another. So this is, you know, if you needed to do it during a full set and you accidentally applied it incorrectly, it didn't bond well, or if you're doing a fill in. Okay. And let me get to the next. These are backed up to each other, so sometimes I want to replay the last one. Look at breaking the bond. This one is not my favorite, because what will happen is, if you're a beginner, you'll end up pulling the natural lash out of the lash line. But they're putting a little bit of pressure on the extension and releasing it. That would only happen if there's not a lot of glue there, guys, and it has just disintegrated to the point where you could do it that well. So just keep that in mind. Now, this is very fulfilling looking. I will let y'all watch this. What you're really going to do here, and even the Borboleta trainer kind of reiterated this, you would put the adhesive remover on the whole lash line, okay, and let it sit for about 10 minutes. Then you would remove it. So what this person in the video is doing is she's kind of over and over again going back and forth until they release with the extension remover. But that's not really necessary. You could leave it on for 10 minutes, you know, and then come back and remove, and you're good to go. So that's very satisfying looking, right? Very satisfying looking. All right. What y'all think about that? It's going to start to come out in just a minute. Going to start to come out in just a moment here. So as you see, the extensions are starting to be released, and then all is good. So that extension remover is really, really nice. You just want to keep in mind that that is a way to do it after somebody's had their extensions in for a couple of weeks. Okay. Then you've got some other aftercare instructions that they suggest. Of course, I've given you other aftercare instructions as well in my other slideshow for you. And then last but not least, they talk to you about marketing. They talk to you about how to get that gorgeous filter going so your pictures look amazing, how to take the white out of the eyes, use really cool hashtags, and just truly build your social media platform. So I hope you guys had a very amazing time with me this morning. We, about an hour and 15 minutes. Awesome job. If you guys will shoot me an email right now with 3 things you learned from this training, 3 things you learned from this training, and we will do more and more training. Remember, at Southeastern Aesthetics Institute, we do 3 levels of lash extensions training. We do theory education, which I'll just received today. Awesome. The theory training also includes mannequin head training, which if you have not done that yet, you will. Then you're going to do eyelash extension 2 training, which is one-on-one with live models with me in small groups. And then we're going to do Lash Team, if that is something you're interested in. Lash Team is such a fun thing, and you do it up in my suite with me. And for those of y'all coming to small groups this month, you can bring your lash kits, you can bring your mannequin heads, and we can do this together. You can also, of course, for my higher up students, my elite students, if y'all want to do lash extensions on each other, by all means, bring your stuff. Let's do it. Get some good checkups, get some good practice with me. I cannot wait to see you guys. And I love you so much. I hope you have the best day ever. And we'll talk soon. Bye, guys.